Hi, everyone. Welcome to Peeling Back the Truth with myself, Ashlee Bunkelman, and joining me is my co-host, Catie Cutler. And this week's session is number 5, lucky number 5. I love that number, so I feel like it's going to be a good one. And today we are going to be talking about injectables and neuromodulators in aesthetic skincare and how that fits in. And we have a very special guest towards the end of our show today. So welcome, Catie. Hi, how are you?
Hi, Ashlee. 5. I can't believe we did 5.
I know, 5. Here we are.
It's
So as a lot of you know, Catie and I, we said on the last podcast that we are getting together this past Friday and Saturday for a little summit with Rachel and Ryan DeVault in Cleveland, Ohio. And it was super fun. Sean was with us as well. And we had a lot of fun, I think.
We did. I loved it. And like seeing you in person is just great because, you know, we do a lot of telecommunication and when we're together, it's good because we just kind of vibe. I feel like, you know,
I love it. It makes my heart happy that I got to see you. And I was kind of sad that it was a quick trip, but we have more to come in the future.
Yes. So, and the event itself, real quick, I really enjoyed. It was, you know, very nice to hear a lot of education. Again, we love education and to talk with Ryan and his wife and about, you know, what they're doing. And, you know, it was really nice. I had a nice time. We met a lot of fun people who were, you know, opening med spas and some people who already had existing med spas and, you know, asking us a lot of questions. And the best part is Ashlee gave me a treatment.
Oh, I forgot about that. How's your skin?
Oh, look,
you look amazing as always, but I totally forgot about that.
I don't think I had a treatment in, I don't know, like 9 months, unless I do it to myself. So it was.
So that's why we need to get together more often in person. I have to say, I loved the event that we did because it was really informative and I love to see Rachel and Ryan DeVault. I think that they have done amazing things in the last 4-ish years with their practices and they're just really down to earth people.
They are down to earth. And I really, Rachel, I feel like I love, you know, the conversation we had with her about education. You know, I can see she is a big advocate about, you know, information and as much information as she already has and as knowledgeable as she already is. She said it just like we say it. You can never be done. You're always learning. There is never a time where you're like, I know everything, you know, so I just really respect that about her. And, you know, that's the kind of person, that's the kind of nurse or injector that you want to go to.
There are kind of people.
There are kind of people 100%. So
and Catie and I, just so everybody knows, we did chat with Rachel DeVault, and I think in the future we might be able to have them.
Yeah, we definitely were talking about bringing her in.
Yeah,
so and her husband, excited.
Ryan.
Yeah.
So I'm excited in the future to have them as well. And again, I'm so honored we were able to go there and present with Sean. And it was fun. It was a lot of fun. And it's always continuous growth in the companies and continued education. And that's what Catie and I stand for. So it was amazing.
Right. And it was funny. Remember, how about so Sean?
By the way, everybody that doesn't know who Sean is our makeshift producer. He's our agent that makes everything happen because Catie and I definitely don't know what technology like Sean does. So we are going to applaud Sean and Samantha today that they are behind the scenes amazing people that get us
here
pushed
with
out
us
on our podcast every other week. So thank you both so much.
But
so if we talk about Sean,
I have to talk about this because I
don't know what's going to come out of your mouth.
I can't take it. But so we were waiting to speak for Aralace at the event and Sean was going to start and then Ashlee and I were going to, you know, kind of finish. And we were kind of nervous, I guess. I really wasn't that nervous, but Sean, I think, had a little bit of, you know, anxiety because we had to get it over with. And plus we had to wait so long. So he just wanted to be done. But we're waiting and we were like, we got to jazz this up a little because it was very educational at the event. So like we were last. So we were like, we were close to last. So we had to bring it in and like, we were trying to be like, you know, get it lively. So we were just like sitting somewhere and we were joking around like me and Ashlee can stand in the background of Sean and be like, you know, do a dance, hold up signs. Well, maybe it's not funny right now to you, but like sometimes, you know, when you're talking about something, it just hits people funny. Well, me and Ashlee and I and Sean and Dan and Emily, we were just dying laughing about it. So
And
Anyway,
then up on stage sitting there thinking about,
all I could think about was
I
like
could do
me
cartwheels
and
right
you,
now. And
like the Rockettes kicking our legs in the background. Yeah. Except we probably wouldn't look like the Rockettes kicking our legs, but we can pretend.
It was all about the support. We supported each other and it was fun. So it was
and we do have a great time together because like as serious as we can be and, doing what we're supposed to be doing, we can laugh with each other too. So that's really cool. All right, let's get into injectables.
All righty. So last time we spoke on the podcast, Katie and I were talking about how you want the full aesthetic package. You want overall good skin health. So when people are coming in, I like to educate them at our medical spa, which is Skin Boss Med Spa. And our special guest today is our lead injector from Skin Boss Med Spa. So I'm excited to talk with her later. I like to explain to people that, you're not just going to get injectables and you're not just going to get neuromodulators and have the quick fix. It's a whole skin health overall. So as much as people may get facials and lasers and skincare, and they need the injectables and the neuromodulators, you have to educate them on that. And I think a lot of med spas lose that a little bit because they get focused on one thing, one division. And I think it's an overall all the divisions. So What do you think, Katie?
Okay. I'm going to give you my short and long of it, or long and short of it.
I'm ready.
You know what I meant.
I know. What you mean.
Okay. So this is how I feel. So being here for 15 years, working in multiple places where they offer injectables and offer everything possible in this industry. This is where I am. I have been in med spas where I feel like the owner or whoever is running the spa feels like their injectables are money makers. Okay. So they're pushing this, right? The other thing about it is people in the world, when they think of their face and doing something, I would say 90% of women, the first thing they think is Botox. It's like, it's just a thing, people who know nothing know Botox. It's like Coke or Pepsi, like everybody knows it. So I feel like a lot of people walk into the front doors of a med spa because they want Botox or they want their lips done. That's also another big thing. But that's great. It brings all these people in, but instead of looking at like it's bringing these people in, great, they're coming in and they're sitting in that room with the injector and they're like, well, I do like my lips or I do like my Botox, but my skin, my pores are so big. I have so many wrinkles around my eyes. My face is saggy, whatever their issue is. I have acne. And the injector, this is it. This is the moment where they can say, why don't you speak with our esthetician? Or why don't you, if they have the experience, explain to them the things they could do for that integrity of their skin, or pass them on to someone in the med spa who can do that for them, and getting them on skincare that's going to, accentuate what's happening with the injectables. And like, that's where it's at. That's where it's at for everyone, the consumer, the injector, the esthetician, and the owner. Everyone benefits from that, So
because it's a full package.
It's a full package.
And I think the reason why the med spa that we work at every week, Michelle and I, our soon to be guest speaker, is so successful is because she crosses over all the time with us. She is constantly saying, I would love to inject those superficial lines for you with some injectable or some filler, but I want you to go see our laser division first because we really want to get that skin prepped and ready for that to happen, because you need the overall rejuvenation first and then come back to see me. Or I really need your skin more balanced before we're putting, something that's hyaluronic acid based into your skin. So we need you to go to the facial division to get some more hydration and balance your barrier. So I think that that's why we are so successful in all divisions of where we work, because we're always cross-referencing, because you can always do so much more with injectables if you have overall good skin health. And that goes for every division. Every division is going to want to have the full aesthetic package.
Yeah. And this is going to bring us back to, honestly, like now I'm really like thinking about it. It shouldn't even be the injector's responsibility. It should be the consultation. This should be happening at the very, very beginning. So when, in a med spa setting, nobody should be calling, making appointments and telling you what they're going to do. It's not a hair salon. You're not calling to say, oh, I want highlights or I want blah, 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 cut. you need to call and say what you
Mhm.
want maybe. And the
Mhm.
receptionist or whoever is running the front needs to say, well, we can bring you in for a consultation. And then in that consultation, it's their responsibility to say, well, what's bothering you? Let the
Mhm.
client explain what's bothering them. And then for the consultant to say, well, here's what I think you would benefit from. It's not just about the injectables.
It's not. And in the way that we kind of work at our med spa is, we have them come in for a complimentary consultation. And that just sets the precedence that we are ready and able to, kind of donate some of our time to educate the consumer, the person that's coming in, the client. And then when they come in, they fill out their questionnaire form. And we always say your top 3 skincare concerns, and they list them and they're most important. And then we always ask, are you interested in injectables? Are you interested in lasers? Are you interested in facials? Are you interested in the body division? So they check that off, and that's
and then you can approach.
Right. And so that it's our job to say, well, I notice here that you're interested in injectables. Would you like to know more about that? And when they say yes, that's when we do a full assessment of their skin and a full consultation, and then say, we're going to, ask that you make a complimentary consultation with our injectable specialist. And, she hardly ever has time because she's so busy, because she's that amazing. But if she does
But even
have
if it looks like
couple
she's
minutes to
doing
come
the
in.
consultation the day they come in, they know they want to get,
Exactly.
and she talks with them and says, okay, I think it's okay that you want Botox, but I really feel like this isn't your problem area. Let's try here. I think you're going to, she can do a quick consultation even at the visit if she doesn't have time to pop into the original consultation.
Yeah. And that's why we always ask them, do you think you would like to do treatment that day of consultation? And if people say yes, we book it out, because people are eager to get it done. And let's face it, when you do injectables and Botox, they want it done right now. They're like, I saw this, I want it done. I was watching Instagram. I want this done. I want that done. But I also think, and I think this is a very important thing to discuss, I think that as an injector specialist, it's okay to say, that's too much.
Enough.
It's okay to
Please.
say, that's enough.
Yes.
And I think that a lot of very credible injectors out there don't say that's enough. And that is one reason why I wanted to bring our special guest on today, because she has no problem saying that in the nicest way possible, to say, I feel that your face can't support that. I feel that, that's too much for your face. And I just think that being honest, Katie, and you and I always are like, being honest is key. And that's where you keep the trust level within patients. And that's why Michelle is amazing at what she does, because she knows exactly how to approach people with it. And then it makes them think, they might be right. My face isn't as large as that person that I saw on TV that has
exactly
4 syringes in their lips.
Yes.
So it's all in the delivery. And I think
is.
that a lot of injectors don't do that.
No, of course, and so we've talked about this before. I work as a teacher, also at the Institute for Laser Medicine in Skipback, Pennsylvania. It's an amazing school, but we also have 2 med spas. So we have Define Med Spa in Skipback, Pennsylvania, and then Strella Med Spa, which is in Springhouse, Pennsylvania. They're all not far from where I live. And I love how the spa connects with the school, because it's, if we have injectable courses there. So doctors, nurses come in, they take the injectable class. It is a full day course. It's an amazing course. We have amazing teachers that teach it. But in reality, you can learn the science and, the anatomy, all that day. But the experience of the injection comes in time. And we let these injectors who come and take the class go to Define Med Spa or go to Strella Med Spa and follow an injector. And that is where it's at. I really believe that if you don't get experience, I trained the girl from the med spa, Carrie, the other day. Yes, she was amazing. And she did so great. But I said to her, do 5 faces. Just do 5 faces after today. And then you can do a client, because she was doing amazing. But I said, just do 5 faces, because everybody's anatomy is different. Get the experience. Same with injectables.
And that's, and to draw attention to that, I worked with her 15 years ago, and that's how we know each other. And I'm really glad to bring her on in our practice. But That being said, she's been doing this for 15 years and she needed continued training. She needed to have you do training with her. And for you to say that to her, do 5 faces and what you were training her with is amazing, because she came, she learned, she doesn't know everything after 15 years. I don't know everything after 15 years. You don't know everything after 15 years. And it's continued education. And I think, we started this, Katie, because we wanted to educate everybody. And just like most injectors, if you as an injector do not get continued education, you run stagnant, just like the rest of estheticians and laser techs and even microblading artists. You have to stay up on your education.
You have to.
And you have to constantly keep searching and looking for things, because if you don't use it, you lose it, right?
And I like, if I hear someone somewhere like where we were this weekend talk about something that I'm not familiar with, or ask me a question about something that maybe I've heard of, but I don't really know it that well, or maybe I never heard of it. I will say, I got to find out about this. Like I won't in the conversation maybe say, I've never heard of that, but I'm going to 100%, research this now.
And I'm going to guess when I dropped you off at your hotel that night, you probably sat there and researched, because that's what we are. That's who we are,
if I ever hear anything I'm not that familiar with, or someone asked me a question, I'll be honest and say, listen, I know the modality of that. And I have an idea what it is, because I do know the modality, because I can really figure that out, because I know that, but let me get a little more information on that device so I can really give you, what it's good for, how it works, so forth and so on. Because even though we can figure out what it does, we don't know how the results are, or what people like the Aralace Neo, Aralace Era. I know exactly what's happening, with them. And I know what results look like. I know how amazing they are and how well they work. But, sometimes someone will mention something that I don't know that, because I haven't worked with it on a regular,
And I think that it's the same with injectors. Like if they go to a conference and they're discussing something that they aren't aware of, a wonderful injector is going to go home and it's going to research that, to just be in the know of the present, not the past, because our industry is evolving every single day. And that's kind of, when I bring Michelle on here shortly, that's kind of what I want to chat about is, her story a little bit, how she got into this, how she is like a breaking through fantastic injector specialist, like nobody I've ever seen. And I've seen injectors on the East and the West Coast, and she's amazing to me, but she's been doing this, a little over 10 years. And she had a huge career before that for over 20 years. And I can't wait to bring her in, because I think it will really make people that are listening to our podcast understand you can't just jump right in and be perfection within a month. You can't just jump right in and be perfection in 6 months. It's constantly a growth. And Michelle will be the first one to tell you is she's great in her craft, but she has to constantly keep up within that craft, because the world is ever so changing all the time. What was a fad 10 years ago in injectables is not a fad now. And what people are doing, tricks of the trade, is not what they're doing now. It changes every single day, like the entire industry does. And, Katie, I'm sure because you're at the school a lot and you're at the med spas a lot, and I do lots of trainings outside of my job. I was just at the University of Michigan training residents there. And and these are derm residents, and it's amazing that a lot of them want to know a lot about like the extra things with aesthetic skincare, but there's things that they don't even know that I'm teaching them. And you would think that, it's a totally different world versus derm. I mean, derm practices all over the country and all over the world have aesthetic practices, but they don't know the craft that we hold within aesthetic skincare.
And I
just think that, people need to know it's not something you dive right into, because you get asked all the time, just like I do, how much training would I have to do? What would I have to do to change my career?
My favorite is this. This is my favorite. Oh, I think I'm going to go to aesthetic school because I want to do what you do, because I want your job. And I think to myself, well, you got a long road ahead of you to get where my job is right now, because I put a lot of time in, and I've been in a lot of places. And like you said, I go places and people ask me, or I'm training a doctor or nurse. I was training a nurse practitioner yesterday, Natasha in Lexington, Kentucky. She was amazing, so sweet and smart. But just because she's so smart, but she doesn't know how to work the Aralace Neo that she had purchased.
Right.
And that's okay. Like, how is she supposed to know that? So, everybody needs to learn. Everybody needs to know something, but I'm sure if I had to do something that she does in her craft, I wouldn't be able to do it ever, so it's all about sharing our knowledge and just, trying to educate each other. So I'm so excited to listen to Michelle. So, whenever you're ready to bring her on.
All right. So our very special guest today is Michelle Ceccacci. She has, how many years as a nurse are you, Michelle? Michelle, I'm gonna actually bring her in. Here's a headphone. On in. We're gonna get really close. Headphones. Don't worry, we're vaccinated, everybody, so we're nice and close.
And you're friends.
And we're friends. So this is Michelle Ceccacci, and
everyone.
Is internationally trained as an injector specialist because she is from Canada. She has trained with some of the best on the East and West Coast and also up in Toronto. So Michelle, give us a little snippet of your life in the past 10, 11 years.
So in the last 10 or 11 years, so I decided to go into aesthetics when I was 36. I was a nurse working in the hospital and I got my first dose of Botox. And I thought, wow, that's something I would like to do. So for many years, I thought about it. Eventually, I went out, started doing the training and got situated in a med spa, and my practice grew very quickly. And I decided that hospital life wasn't for me anymore. I had put in my 23 years and I've never looked back.
I'm so glad you just talked about that, because I feel like, especially right now, there's so many nurses who are just because of, what's going on in our world that are like, just get me out of this hospital, get me out of this scenario. And I would love to get into medical aesthetics. And it's a crossover, but Michelle, did you learn it in nursing school?
Absolutely not. I will tell you, probably the first year and a half that I started injecting, I didn't sleep. You were very nervous. You were always learning something new. You wanted to make sure everyone was okay, and you wanted to make everyone happy and please them 100% of the time.
Because there's dangers, and you can talk
there
are, risks to some
degree. And there's
high
expectations. People come in and they see TV, they see YouTube, and they want to be that person. And so many times I have someone who's never done anything. They could be late 40s, early 50s. They've been a sun goddess. And all of a sudden they want to look like someone on television who has beautiful skin, no lines, and has been taking care of their skin for the last 30 years. So it's the expectations. And often I will, if I'm treating another nurse, I get this a lot. Oh, Michelle, when you were a nurse, I'm like, no, I'm still a nurse. I am a nurse, because you deal with medical histories with people. Not everyone should be getting injectables.
Facial anatomy, you have to know that.
Absolutely.
Like the back of your hand.
It's constant training. And they all say the same thing to me. I want your job, Michelle. I want your job.
Okay, you can have it. Go to nursing school. And then you have to work in the field for 10 to 15 years. And then here we are.
And build a clientele.
It didn't happen like that. It didn't happen like that.
And I think too, it's a beautiful job to have, but I think Michelle can kind of fill us in. As much as she absolutely loves her job, it is a lot of work on your body. It's a lot of work on your body. And I think people, doing it, 5 days a week, they're going to end up ruining their body doing it that much, just because it's a lot of work on the body. And Michelle will tell you, there's been days her and I work kind of across from each other, and she's like, gosh, it's been such an amazing day, but man, my feet hurt, you're constantly go. So for the nurses that want to get into this because they're in a hospital facility,
it's physical.
It's physical.
We were talking about that this weekend.
We were talking about it with Rachel.
Oh, with Rachel, right? And she was saying that her arm sometimes is like she has to get a massage or whatever because she's so
her hand arthritis.
Oh, she said if she doesn't inject for like a day, her hand's like bothering her. So it is physical.
It's very rewarding, though. I will say that I love meeting all the women and some men. Men are getting into the injectables too, and it is very rewarding. It is hard work, but it's also gratifying.
Yes.
And I love the people I'm meeting. And I
Can
love
I just
working
say
with
something?
Ashlee.
Yes, me too. Can I say something like that I think's funny, but maybe I really shouldn't think it's funny, but it's funny to me?
Go
I'm
ahead.
ready.
And tell me if you think that it's off base or is this really happening? Because I think it's really happening.
Okay.
So like I have people say to me, and this is pretend the lip flip never came about. Let's go back to the times when Botox was only allowed on your forehead.
Mhm,
Even
correct.
crow's feet was not FDA approved yet. Okay. Let's go back to those times.
Just
And
so
people
everybody
would-
knows, Katie's accent just came out with the forehead.
Forehead.
I
Is
love
that
when
what
she
said?
says forehead. Okay, go ahead.
Laundry. I know. So, yesterday they were in all of my talking. I was in Kentucky. They were like, y'all, you talk so cute. And I was like, I'm not the
You're like,
one
I'm
with
not
the
talking weird.
accent
You're
here."
talking weird.
Yeah, one of the patients left and I was like, bye y'all. And they were like, there you go.
Oh
But
my
anyway,
goodness.
so I remember people would say, like back when that was the situation, oh, I want to get some Botox in my lips and plump them up. What do you do? It's like you
Mhm.
can't put, you can do a lip flip now with Botox. So I want to make that clear. But
Mhm.
at that time, Botox and filler, they're not the same thing. One is a neurotoxin, one is hyaluronic acid. They're not. Filler fills, Botox freezes. Like I want to make that really clear because people get very confused.
I get it all the time. This is what I
Yeah.
get. Michelle, can you put some Botox here?
No, I can put some filler there.
I can put some filler there.
But Michelle educates that patient. So there's
Of
some people that are
course.
like, oh yeah, I'm going to put this and this and this here. And they're not going to see what it is. And they're like, that's why they go to the next place. And like,
Mhm.
I want Botox right here.
Yeah.
Like right in that
No,
tear
you
trough. I
want
want right there.
filler. So real quick, why don't Michelle, if you could,
Mhm.
quickly, just give us like, what is Botox and what is it made of and what products are popular in that neurotoxin category? And then what is filler and what it's made of and why some fillers are thick, some are thin, some are medium and what the reasons are for all of that. I think that would be helpful for someone
Yeah.
going to get injections.
Sure. So let's start with everyone's heard the word Botox.
Mhm.
So it's a neuromodulator. In that family, we have Botox, Dysport, Xeomin, Jeuveau. And what they're doing is relaxing the specific muscle that you're treating, whether it's the frown, which I can't frown too much, whether it's crow's feet, whether it's the forehead. So it's relaxing that specific muscle for a duration. It does wear off, and I let everyone know that. It works about for 3 to 4 months, and it's an amazing product. And everyone knows Botox. So, and it has they have great results. As far as filler, the dermal fillers, everyone has heard, of course, Juvederm, Restylane Lift. They're a complex glucose. It's hyaluronic acid, which our bodies already have.
Mhm.
So they're great for lifting, plumping, for lines, and they have different consistencies. So some are thicker, they add volume to our cheeks, temples, jawline, and then we have the softer one, which I like for lips. I don't want to, some people want a plump lip, some people want a more hydrated lip. So even then, we can go into a thinner product and soft products.
Like a Juvederm, Vibella, is that a velour? Which one's the
So
thin?
there, the Vobella is great for fine
Okay.
lines.
Mhm.
Velour, I like for even nasolabial folds or marionette. Juvederm Ultra is also great for plumping lips, but I also love Restylane Kiss for
Mhm.
fine lines and redefining that border along the lip line, the vermilion border.
Mhm.
And obviously Restylane Lift, Voluma for cheeks. There's so many great products out
So
there. And I
Voluma
only
and
work
Lift
with
are thick. They're a thicker filler that
a
you would
thicker
use in the
filler,
cheek, where
the
velour
cheek,
is
the
for the lip.
jawline, the
Mhm.
chin.
Yes.
And I like working with the hyaluronic acids because, like we always talk about, there could be complications, and as they are rare, but if you were to get into an area where you felt like you needed to take it out, you can dissolve it.
Right, because
So
you
that-
can use.
Yes, you can use some Hylenex, hyaluronidase, and you can dissolve it. So it's good to stay safe. I'm not trying to be a cowboy out there, but I'm definitely trying to make people happy with excellent products.
Well, thank
Let
you.
me-
Oh, go ahead. I
I
just
want
wanted
one-
to tell them,
just-
tell one more. I know I'm like,
Yeah,
tell
you
everything.
go first. You go first, and then I'll go. We have just so many
Can you
questions.
just like a quick, like explain, and I know we don't have a lot of time, but you see a lot of people on Instagram or here and there, injecting themselves and that the derma pen or whatever, the injecting pen.
Yeah.
Can you just give us a quick reason why things that could happen, why this is so dangerous? What could happen, besides it looks bad? That's what they're concerned about. But what could happen really that could cause a lifetime problem?
So I have run into a few people that have done that. They've purchased something online. They don't even really know what they purchased, because in order to purchase excellent product, first of all, you would have to have an account. You're not going to have an account as some person sitting at home who's
For
watched
Allergan
YouTube,
or
Right.
correct, or Galderma. So first of all, what did you just purchase? Where did it come from?
and what did you put in your body?
And what did you put in your body? Is it reversible? Now let's talk about the person doing it to themselves. Do you know the anatomy of the face? Are you injecting a filler into your muscle? Are you injecting it into a blood vessel? And what you think might be a bruise could be a vascular accident. So what happens then? You've occluded a blood vessel. That means there's no oxygen supplying that area it should be supplying. Now you're going to have necrotic tissue. And I hate to say it, but depending on where you went, if it starts to travel, do you end up with a little bit of a stroke, some blindness? And I do know someone that, a friend of one of my daughters, she went to a person's house and got injected in the basement and had her glabellar line filled. She ended up at a hospital for 2 weeks. They think she had a mild stroke. And they do believe it was from the dermal filler. So I don't recommend that to anyone. And I think because people are watching YouTube all day, it looks easy. The people that are injecting on YouTube, let's say that are professionals, they're showing you the easy part, the good part,
The good part, the
out.
easy part.
Correct.
But the people who are injecting like yourself, properly have the education and they know what's going on. If you're in a vessel, you're not going to shoot high filler.
And you're
into the
also
vessel.
doing it in a very sterile manner, as sterile as you can get skin.
Because you can put dirt
That's
into the
huge.
skin or, makeup into the skin if they're not cleansed properly, and
Absolutely.
alcohol prior. So there's so many levels. Basic, like bottom line, please go to a professional,
Yeah.
someone who knows
Bottom line.
what's going on.
Absolutely.
So there's two
Absolutely.
things I want to kind of talk with Michelle about, just because we're talking about fads and how things are different now than they were years ago. Michelle, can you tell us a little bit about Aqua Gold?
Yes. So Aqua Gold, when that came out a couple of years ago and it became more popular and more popular, it is a glass container with 24 karat gold tip, little needles, little fine needles. It's very comfortable. So what we can do is put in our own mixture, a neuromodulator, Botox, Dysport, Xeomin, hyaluronic acid. Ashlee's come up with a few good serums for me to add
We
to
call it our
it.
cocktails.
Our cocktail. And it's great when you have that special event you're going to. So for instance, we would cleanse the face, and all I'm doing is basically stamping it everywhere. I can go completely under the eyes, on top of the eyelids, all around the mouth. And it also will make your skin look great. Fine lines makes the pores look smaller, and it's very, very safe and comfortable. It's a great little treatment, that little extra bonus when you have that big
Gives
event
you that
too.
wow factor.
It sure
We have
does.
patients that love it. They're like, I'm just obsessed with this. Like, it's great. And I have, on average, our patients are always like, it's like great for a couple weeks, and then I need more and I want more.
Yes.
And so for those special events, I love that people are so happy with it.
Absolutely.
And what about just a question? Here's a question, because I don't know everything. When you are putting that into the skin, are you reaching the dermis, or is this completely superficial?
This is very superficial.
Okay.
So, and that's why it's completely safe too. And you can go everywhere around the face.
Because
And
it's
I
not
usually-
getting into a muscle that it would actually.
No.
Yes.
And it'll penetrate. And, there are muscles that are very, very superficial up towards the epidermis. And so
It might
it's
penetrate
around the eyes. Correct. And I always have a little extra, we like to put it in the neck
Give a
too.
little. Yeah.
Yes. Always make it worth their
So
while.
it just kind of relaxes things. So everything's not so like.
And it helps with the pores, little fine lines.
Mhm.
And with the serum that we put in, it's just absolutely fantastic.
I
Okay,
gotta come to Michigan.
I know, I'm
because
ready
I
for
want
you to
We
come
want
visit.
you to come to
We
Michigan.
want you. We need you.
I just want to be locked in a room with Ashlee and Michelle, both of them giving me all of it. Whatever you want, you give it to me, and then I'll just leave.
And then you can treat me, and then you
Yes,
can help me
I'll
treat
stay
Michelle,
and treat you
and
guys
it could be like a whole day.
It could be like an
Absolutely.
all-day event.
It could be amazing. Okay, one more thing I want Michelle to touch base on too. Pdo Threads.
Oh,
Can you
yes.
tell us a little bit about Pdo Threads? Because it's major hype right now in the media. You're seeing everybody on Instagram, this plastic surgeon, this doctor, this derm, this nurse, all of these people doing it. Can you explain it a little bit to us, Michelle?
So the Pdo Threads are threads that we've been using in surgery for years. And they're always coming out with a better thread. So they're barbed when you want to do the pickup. So they're barbed in a bi-directional way. And there's also other ones coming out.
So when
That
you
is an
say
area
barbed bi-directional, I'm going to just clear it up a little bit. So it's like a
crisscrossing.
little hook right at the bottom
Yes.
when you feed it in, and then it catches onto
To tissue.
tissue, and that's how you get that lift,
That's
right?
correct.
Okay.
That is correct. And there's many brands out there. Right now, I work with the Pdo Threads. And the one thing I will tell people, it is very safe. Generally speaking, not much bruising because it is in a cannula, and a cannula is not a sharp object. So that thread has been put into a small, like a little metal tube. And we make little portholes, and then we slide it through, and then we want to put it in the direction where we want to lift. The one thing I will say is the most important thing with Pdo Threads is making sure you pick the right patient. It's not for someone who has very, very heavy tissue and it's really hanging down. And I think that's when you have to be very honest, where that person might be more of a surgical patient. And it's great for that person that's in that gray zone where, you know what, last year I thought I looked great. My jawline looked great. And now I feel like I got that jawline going on. So often that is also, you know how we were talking about earlier, the lasers, peels, neuromodulators, filler. It's not one modality, it's multiple.
Multiple modalities.
So
I'm glad you just said that.
Often with Pdo Threads, I say you probably need filler too. So you might need some voluma or rest and lift to help pick up the cheek, as well as do the lower face and upper neck.
Yeah.
And it's usually a combination. And I tell people, when you look at a woman who's 50, 55, and she looks great, it's not one thing she's doing.
No,
It's
she
many
didn't
things
go.
she's doing.
That's another wonderful question I get. What
Yes.
should I do? What should I do?
Do
And
it
I'm like,
all.
well, I
Everything.
can sit here with you for an hour if you want.
Yeah.
No, not that you need it, because that's why it's going to take so long. It's going to take so long because this is a lifestyle. This is
It
not
is.
something, we
one
go
and
to the
done.
gym as a
Not a
lifestyle.
one and
We
done.
eat like a lifestyle, correct?
Yep.
So it's like
Absolutely.
your lifestyle. If you go to the gym for a month every day, right, and you eat really healthy that month, you lose 10 pounds. And then that right after the month, you're going to McDonald's, you're going back to life,
Yeah.
laying in bed,
Yep.
doing that. What's going to happen? All that
Lose it.
process is going to be lost. So it is better to exercise once or twice a week, eat healthy most of the time for your lifetime.
You can have your
Then-
cheat days, but
Yeah.
You can have your cheat. So with your skin, it's a lifestyle. You have to take
It
care
is,
of it at
totally.
home. You have to visit, a professional here and there, whatever you can afford. Do something a little aggressive, maybe every 6 months. Then in between, little things, get your injectables when needed, but you don't have to go crazy.
Yes.
We go to Starbucks, 10 times a week? Some women, how much money can I spend at Starbucks? Save it. Put it
Yeah.
aside, make your own
Yeah.
coffee, whatever it takes.
Exactly.
If you want to feel good about yourself and you feel like it's too expensive, it doesn't have to be too expensive,
no.
because there's
No.
moderate things. There's always something you can do for improvement, whether
Absolutely.
it's mild or major. And I just, make it your lifestyle. Go talk to someone, get good
Agreed.
skincare at home. Go talk to
Absolutely.
anyone will talk to you for free. And you
For
can
sure.
get,
Yep.
you can get
Yeah.
an idea, get an
Knowledge.
education.
Yep.
I'll tell you a scenario that I run into all the time, Katie. Someone will come in, let's just say 44, would like Botox. So we're talking, and I have to say I'm blessed with great skin because Ashlee has been working on my skin for 10 years. And I'm not afraid to say what works for me and what doesn't, but I have great skin. So that's one of the pluses for me. And I will get this all the time. Oh my God, Michelle, I want your skin. And I say, okay, so
Let me tell you.
so what they'll say to me, I'll say, well, do you do any lasers or peels? Because I do have Botox on board or Dysport, but I also take good care of my skin. I get this all the time. Well, I did get a laser and my whole face peeled off.
I love this
And
one.
it was, oh my God. But I did get good results. And I said, okay, well, when did you do that?
And what was it?
And you
I
know what
don't
they say to
know.
me? Well, I did it 3 years ago. And I said, well, I'm going to tell you. That is not something you do what has happened in 3 years? In 3 years, you aged. In 3 years, you were
were in the
exposed to the
sun.
elements.
Who knows how
And
you took care of your skin?
Our collagen's always dropping. What you did is a yearly treatment, whether it's in January, in the winter, whether it's in the fall. That's not something you do every time 5-7 years. That's a yearly treatment.
Yes.
And I said, I do yearly and monthly treatments.
Of
And
course.
so that's how I get this skin, because
Because you take care of it.
I'm taking their photos. I know their age. They don't know my age. And when they find out I'm 7 years older than they are, then they go, oh my God. So what laser should I get? And that's when I hand them over.
And like, you know, when people say that to me, well, your skin looks good. What do you do? I said, you have 2 hours. We could just sit down.
What don't I do?
Yeah.
So I want to,
when I say that, let me just defend myself here. Like when I say, what don't I do? I don't mean things that are aggressive, like needles.
Yeah.
I'm talking about what don't I do with my products,
at home
with my
regimen.
chemical peels.
Mhm.
I'm more about that mild Botox, mild filler, you know, in my lips.
Correct.
I don't want to be full of a lot. You know, I want to look like me. I want to look like good for my age, not 22.
Right.
Exactly.
I don't want to look
exactly.
like crazy. I want to look, you know, youthful, healthy, you know, attractive for 50. You know what I mean?
Absolutely.
Yeah. So
50. You're killing me, Katie.
You look fabulous.
God.
And people say
look
to me,
amazing.
you look natural. And I don't want to look like those people you see on TV.
I'm afraid
But
of
those
that.
are
Like,
choices. Those are
you have to start to know when
Yeah.
things are getting a little kooky.
Little self.
Yeah.
Yeah. I want to make note that Michelle was talking about how she does her maintenance stuff. Michelle just had on Monday night a Neo by Aerolase full face with a Glytone pyruvic acid chemical peel.
Oh, I love
And
that combo.
I want to show everybody
Amazing.
here, her skin isn't falling off. She's not bruised. She doesn't look
No,
like a burn
it's
victim.
just
She looks absolutely amazing, glowing. She actually took her time 2 days ago to call me. And she's like, Ashlee, I have no pores. My skin feels so firm.
Your skin looks phenomenal.
She always does,
It does
this
look
great
good.
though.
I'm
And
very
the
happy.
pyruvic peel by
Oh.
Glytone, I'm like crazy. It smells like pancake syrup a little bit. Did you think that?
I
Some
thought it
people
was
say
vinegar.
butterscotch or vinegar. That's what I get in my
Butterscotch, vinegar.
trainings.
But it's such an amazing peel.
Oh, I love
it.
it.
And to
works
be honest,
so great.
the treatment, not only was it amazing, like my skin looks excellent, but it didn't hurt. It felt great.
No, it's not.
She
I
loved
was
the way
so
the Neo
happy.
felt. She loved the way
I
the Neo
love.
felt.
So
Yeah, when you
happy.
mix
And I'm
that
like,
with the
that's my
Neo, it's
go-to.
just phenomenal.
And speaking of Neo, people should always be educated. Doing a Neo before they get neuromodulators or fillers only helps their
Amazing.
skin.
It's such
Like
a great
right before, because it will help with their bruising. If they're prone to
blood
bruising,
flow.
it will help the needle go in more
Oxygen
comfortably
levels,
because
yeah.
the skin is heated up, the tissue's heated up. So I always, want to put that out there, Katie. You know, you and I, near and dear to our hearts, Aerolase Neo, we love.
And like the Neo, Aerolase Neo, really, there's not really much you can't combine with it.
Oh,
Prior.
as long as you do
There's
that
really
first.
not.
As long
And
as
if
do
you
that
have
first.
a Neo, or if you don't have a Neo, you should get one. But if you have one and you're not doing that, and you're not using it prior to multiple treatments, you're really missing out, because you just don't realize it's so huge.
Going back on the Pdo Threads, I do want to give Michelle a shout out. If people are on Instagram, if they go to Skin Boss Michelle, Michelle, I saw her do a Pdo Thread case last week, and the before and amazings are on Instagram, and it is crazy. This lady
call
looks
fast.
Yeah.
You
So
might not get an
this lady
appointment.
looks crazy, amazing, like the most amazing before and amazing I've seen, to the point where like New Beauty Magazine was commenting on it. And they were like, this is
Ooh.
absolutely phenomenal. So again, Skin Boss Michelle, Michelle, for everybody, you have to go look at this Instagram photo because it's phenomenal. I didn't want to get too far off topic, but I think, do you have any more questions for Michelle? I mean, we could go on.
So
for like
I was
hours,
just going to
but-
say this. So we're like kind of getting past.
So when
our
are we
time.
meeting up?
I know I'm coming to Michigan, baby.
Or you're going, or Michelle's coming with me to you.
Okay, either one. But I just, I really don't think this is a one podcast presentation because
don't either.
I could
We'll
talk
get
to Michelle
accelerated
for
if you
hours
come
about
back.
all
If
this.
you come back.
So
Thanks
I
for
do
having
think
me.
though, in our credit to the three of us, we gave a nice amount of information for the beginning. You know, we don't
Absolutely.
want to overdo it. And then people are just
Mhm.
like, what are they even talking
Yeah.
about? So
Yep.
we talked about the difference between neurotoxin and fillers, which is important. A Botox, Dysport, Xeomin, you know, Juvederm, Restylane, they're different. So we talked
Mhm.
about that. If you're confused and I'm saying it too fast, Google it.
Mhm. So
You
some
know what I
myths,
mean?
some myths.
Yes.
Botox doesn't act as a filler. Botox is going to relax the muscle. It's going to
Mhm.
freeze. It's not going to fill.
Yes.
Some truths. It's a lifestyle.
It's a
Skincare and
lifestyle.
aesthetics is a
Yes.
lifestyle. That's a truth.
That is a
Another
truth,
myth.
truth.
You can't learn everything in injectables and neuromodulators overnight. That's a myth.
Or in anything.
It's
You
a
can't learn
constant
anything.
growing, changing.
I always say
constant.
that. Do people go to college and on graduation when they throw their cap
I know
up the next
everything.
day start a job in a firm like the best
Well,
firm? Even
some
if
might
they're
think they
lawyer.
know everything. They might
I
not.
mean, everything needs experience. You got to put your time in.
Absolutely.
And like a big philosophy in my life is before there's greatness, there's always pain. There's always work.
Absolutely.
You know, it's always that way with everything in life. Nothing's just great. You know what I mean? Like, you know, when you have a baby, it's the greatest thing in the world, but you had to be pregnant for 9 months.
Yep.
You know, everything
You're
has
growing.
work and pain or, you know, tough times before you get amazing. So that's just how life goes. And
Yeah,
it's
absolutely.
no different here, you know? So, but
Do you have any
anyway,
more truths
you're
or myths,
amazing.
Katie?
Remember let me think. And I know a truth. Even this is a good one. You can put filler in smile lines, and those lines that you get from smiling, the filler will work well for that. No.
No.
So I always say, here's the deal. You have a piece of paper, like loose leaf. Is that a thing, loose leaf, or is that like a Philadelphia?
No, I know.
Yeah.
Okay. So you have a piece of
thing
loose
here.
leaf and it's nice and flat and perfect. Then I fold it. Okay. And now it has a crease in it. I iron it. The crease is gone. I fold it. The crease is back. So like you can put filler there, right? But if the person is smiling, relaxing, smiling, in 3 days, the filler filling that line is gone. And then they might have a poof because the filler didn't really need to be there. It just, they wanted that line. So filler's not really always for the nasal labial.
No.
Sometimes cheeks will give you a lift and give you that look you're looking for. And filler can make it pump out. So get your knowledge, ask your injector.
I think I'm just thinking about that, Katie, and I am thinking a little bit about next podcast because we do have a lot of our younger crowds ready to get into filler and neuromodulators and things like that. What if we talk about like millennials getting into the lifestyle?
Let's do it. And I just had a text, I'm not kidding, this morning from one of my daughter's friends saying, Katie, I want to get filler. What do you think? And I want to get Botox. Can you tell me what, you know, blah, blah, blah. And I'm like, this child
Can we talk
is
about
21,
first of
and
all
I'm
how
thinking,
old she
but
is?
it
Yes,
can be
because you have a
prevented.
21-year-old. That's crazy.
So I don't have a problem with plumping lips for a 21-year-old. I mean, it's okay as long as it's, you know, classy and it looks nice.
Yeah.
I don't even have a problem with someone who has anatomy or hereditary that they have very intense, you know, frown.
Yeah.
I mean, lift, whatever. What do they call it? Horizontals?
Well, your frontalis.
Yeah,
that. Yes.
So some people, when they lift their eyebrows, whether they're, my little daughter's 10, she has it. I don't have a problem with relaxing that to prevent,
Yes.
you know, very deep wrinkles in the future. You know, so I don't. So let's talk about that. How millennials can use these things, but let's use them in moderation.
Yes.
What they will help with, not to look like a different person.
Let's go over that next. Let's do that in 2 weeks. I think it'd be great.
Let's do it.
We'll have
and
a
we
guest
can
on,
bring a guest on. I know a really great young esthetician. Her name's Amanda. She is so smart. She works for a lot of different makeup companies, and she is a licensed esthetician, and she's like 23 years old, and she's got all this under her belt already. So let's, you know, maybe I'm going to talk to her. We'll bring her on, and she can give us her perspective, you know, where she's coming from and where her friends are coming from and people in the industry are coming from.
That would be awesome. Well, Michelle, thank you for your time today.
Thanks for having
we
me.
have to have you back for like session 2, like more advanced course, if you will. So thank you everybody for listening to our podcast number 5.
Thank you, Michelle. It was so amazing talking to you.
And join us again in a couple weeks for Peeling Back the Truth. And we look forward to hearing everybody. And Michelle, do you want to give a special shout out to your med spa that you work for?
Yes, I'll give a special shout out to Skin Boss Med Spa in Haslett, and come and check us out.
That's in Michigan,
Yes.
right?
Yes.
Okay.
Yes. Haslett, Michigan. You got it.
Yep.
Thank you, everybody. And Katie, we will talk soon.
Talk soon, babe. Bye.
Bye.